Well, that decision on lifting Leicester's lockdown, if and when it comes, was always going to be guided by science. So what do the figures say about how the COVID outbreak is being controlled? Here's our social affairs correspondent, Jeremy Ball.
Yeah, tackling this has been all about ramping up testing at drive-in centres, walk-in centres, even door-to-door. They're watching the so-called infection rate. That's the number of positive COVID tests each week for every 100,000 residents. Now, as you can see, it peaked in Leicester at around 144, but over the last month that infection rate has fallen significantly. Last week, down to around 56 per 100,000. Here's what happened in Oby and Wigston over the same time period. The infection rate there has fallen too, although there was a slight spike last week after testing was ramped up there. But both of those areas have now been overtaken, first of all by Blackburn with Darwen, which recorded a positive test rate of around 87 last week, and now Oldham too. The rate there also crept above Leicester's in the last few days. Now, they're all still much higher than the national infection rate. That was just 7.7 cases per 100,000 last week. But Leicester's Director of Public Health says that's partly because they're searching for infections more thoroughly in the city.
What it has done, of course, is you go looking for people. We are actually case finding as opposed to just testing people. And invariably, if you look, you're going to find. But it's the right thing to do in order for us to really allow people to break that chain of transmission and do the right thing. But it has an effect on the numbers, of course.
Now, one really big question. Has Leicester's lockdown prevented a spike in coronavirus deaths? So far, at least, it does look that way. The most recent weekly COVID figures show 5 lives lost in Leicester with another 4 in Leicestershire, but those numbers have been falling consistently.